Have you ever wondered why some people struggle with focusing or controlling their behavior? Join us as we explore what you may not know about ADHD, attention deficit hyperactivity disorder, and learn how to support those living with it. Attention deficit hyperactivity disorder, ADHD, is a common neurological condition that affects an individual's ability to focus, control behavior, and regulate hyperactivity. ADHD is divided into three main types: hyperactivity, inattention, and impulsivity. In the US, the prevalence of ADHD is on the rise, with approximately 9.4% of children and 4.4% of adults affected by this disorder, according to data from the Centers for Disease Control and Prevention (CDC). Identifying and treating ADHD is crucial, as it not only impacts learning, but also affects social communication and work performance. If not diagnosed and treated promptly, ADHD can lead to long-term issues, but with early intervention, individuals with ADHD can significantly improve their lives and unlock their full potential. Attention deficit hyperactivity disorder, ADHD, can manifest through various symptoms, severely impacting the daily lives of those affected. One of the most prominent symptoms is hyperactivity, where individuals with ADHD often exhibit uncontrollable behaviors. This may include always being in motion, unable to sit still, or talking continuously without knowing when to stop. These behaviors not only make it difficult to engage in normal activities, but can also affect their social relationships, as they tend to interrupt or distract those around them. Another significant symptom of ADHD is inattention, which involves difficulty maintaining focus on a task for extended periods. People with ADHD are easily distracted by external factors, or even their own thoughts, preventing them from completing tasks effectively. They often forget important details, overlook instructions, and tend to give up on tasks when they encounter difficulties. This not only affects their ability to learn, but also diminishes work performance and personal relationships. Finally, there is the symptom of impulsivity, or acting without thinking. Individuals with ADHD tend to act hastily, lacking consideration, or failing to think about the consequences before making decisions. They might respond immediately without fully understanding a question, engage in tasks without planning, or create unwanted situations due to impatience or a lack of self-control. This behavior can lead to risks related to health, finances, or social issues, such as causing arguments or conflicts in personal and professional relationships. When these symptoms combine, they significantly impact the ability to learn, work, and maintain social relationships for individuals with ADHD. It is crucial to identify and treat these symptoms early to improve the quality of life for those with ADHD and help them unlock their potential. The causes of attention deficit/hyperactivity disorder, ADHD, are a combination of several factors, including genetic, environmental, and biological influences. Genetics plays an important role in the development of ADHD. Studies have shown that if a family member has ADHD, the likelihood of the child also developing the disorder is higher. Genes involved in regulating neurotransmitters in the brain can affect a person's ability to focus and control behavior, thereby increasing the risk of developing ADHD. The environment also has a significant impact on the development of ADHD. Environmental factors during the developmental stages of a child, especially during pregnancy and early childhood, can contribute to the onset of the disorder. For example, exposure to tobacco, alcohol, or toxic substances during pregnancy, or children born into environments with high stress, a lack of care, or material deprivation, can increase the risk of ADHD. Additionally, lack of sleep, poor nutrition, or insufficient physical activity in children can also influence the development of the disorder. Finally, biological factors, including an imbalance of neurotransmitters in the brain and brain structure, are an important part of the causes of ADHD. Studies have shown that individuals with ADHD may have differences in brain structure, particularly in areas related to behavior control and attention, such as the prefrontal cortex. These differences can reduce the ability to maintain attention and control impulsive behaviors, leading to the development of ADHD symptoms. Diagnosing ADHD is a crucial first step in treating this disorder. When accurately identified and treated correctly, individuals with ADHD can improve their focus, control their behavior, and lead a better quality of life. The diagnosis process is complex and needs to be carried out carefully to ensure accurate results. To diagnose ADHD correctly, healthcare professionals must apply various methods, as the symptoms of ADHD can resemble other conditions and may not always be easy to recognize. This process not only helps determine whether a person has ADHD, but also helps assess the severity of the disorder and develop appropriate treatment plans. One of the first and most important steps in diagnosing ADHD is interviewing the patient and those close to the patient, especially parents or teachers. This helps healthcare professionals gather information about the patient's behavior, habits, and symptoms they display in daily life. Interviews also provide insights into how the patient reacts in different situations, assisting experts in making a more accurate diagnosis. Information from family members is also essential, as children or adults with ADHD may sometimes fail to recognize or fully describe their condition. Another essential method in diagnosing ADHD is behavioral assessment. Experts evaluate the patient's behavior in various situations, particularly focusing on symptoms related to inattention, hyperactivity, and impulsivity. Behavioral assessments may include practical exercises or direct observation of the patient in social or academic settings to observe how they react. This helps professionals clearly identify ADHD symptoms and differentiate them from other behavioral issues. Sometimes, in-depth testing is also performed to accurately determine the presence of ADHD. These tests may include evaluating other psychological factors or ruling out other conditions that may present with similar symptoms. For instance, anxiety disorders, depression, or sleep issues can cause inattention and impulsive behavior, so excluding these factors is crucial in the ADHD diagnostic process. The ADHD diagnostic process cannot be complete without the involvement of experienced healthcare professionals, including neurologists, psychologists, and psychiatrists. They play a crucial role in conducting tests, analyzing results, and providing an accurate conclusion regarding the patient's condition. These experts rely on the collected data to assess the severity of ADHD and determine the most effective treatment methods. Accurate and timely diagnosis is essential, as it not only ensures that the patient receives support from the outset, but also contributes to improving quality of life and minimizing potential future issues. When diagnosed with attention deficit hyperactivity disorder, ADHD, seeking and applying the appropriate treatment method is crucial to help the patient manage symptoms and improve their quality of life. Treatment methods for ADHD may include medication, behavioral therapy, and psychological support, and depending on the specific case, these methods may be combined or used separately to achieve the best possible outcome. Treating ADHD requires a comprehensive approach, combining the use of medication, behavioral therapy, and psychological support to help patients manage symptoms and enhance their quality of life. Each treatment method may be used individually or in combination, depending on the severity of ADHD and the needs of the individual. Medication is a popular and effective method for reducing ADHD symptoms, especially for children and adolescents. Stimulant medications such as methylphenidate, Ritalin, Concerta, and amphetamines, Adderall, Vyvanse, are commonly used because they enhance the activity of neurotransmitters like dopamine and norepinephrine in the brain, helping to improve focus and control behavior. Research has shown that stimulants can significantly reduce ADHD symptoms in many cases. However, not everyone responds well to these medications, and some may experience side effects such as anxiety, insomnia, or reduced appetite. As a result, doctors closely monitor and adjust the medication dosage as needed to ensure it is appropriate. In addition to stimulants, there are non-stimulant medications such as atomoxetine, Stratter, and guanfacine Intuniv. Non-stimulants are typically used when stimulants are ineffective or cause unwanted side effects. While non-stimulants may not provide the rapid effects of stimulants, they can offer long-term improvement and are less likely to cause side effects. Behavioral therapy also plays a crucial role in the treatment of ADHD, particularly in helping patients develop behavioral management skills and improve self-control. Behavioral therapies include skills training, such as organization, planning, and problem-solving, and behavior modification techniques, like reward and punishment systems, to reduce undesirable behaviors and encourage positive ones. Learning these skills can help patients maintain focus, self-manage their behaviors more effectively, and improve social interactions and academic performance. Finally, psychological support, including individual and family counseling, is an important part of ADHD treatment. Individual counseling helps patients gain a better understanding of their condition and develop coping strategies for managing ADHD symptoms. At the same time, family counseling helps loved ones understand and support the patient more effectively, reducing family stress and creating a positive support environment. Psychological support can help patients improve self-confidence, reduce anxiety, and cope with everyday challenges more effectively. Attention deficit hyperactivity disorder, ADHD, can have far-reaching effects on the lives of those affected, impacting various areas such as education, social relationships, and work. Each of these areas faces unique challenges that individuals with ADHD must contend with, which can ultimately reduce the quality of life if not identified and treated in a timely manner. In terms of education, ADHD can lead to significant difficulties in maintaining focus and completing academic tasks. Children and adults with ADHD often experience poor performance due to being easily distracted, forgetting assignments, or failing to meet deadlines. They may also struggle with organizing and managing time, further exacerbating poor academic performance. Learning can become stressful and challenging, and without intervention, individuals with ADHD may experience feelings of failure and a lack of confidence in their learning abilities. In terms of social relationships, ADHD can lead to feelings of loneliness or difficulty in establishing and maintaining connections with others. Symptoms such as impulsive behavior, impatience, and inattention can make it challenging for individuals with ADHD to communicate effectively with friends, family, and colleagues. Inability to control behavior, speaking too quickly, or even forgetting important details in a conversation can lead to misunderstandings and conflicts. The feeling of isolation and difficulty connecting with others is a common issue for those with ADHD, especially when they do not receive support from those around them. Regarding work, ADHD can also present significant challenges in maintaining long-term employment. Symptoms like trouble focusing, easily getting distracted, and acting impulsively can reduce work efficiency, making it difficult for individuals with ADHD to meet deadlines. They may also struggle with maintaining good relationships with coworkers and supervisors due to impulsive behavior or impatience. This can lead to difficulties in sustaining long-term employment and even job loss if timely interventions are not implemented. To support individuals with attention deficit hyperactivity disorder, ADHD, in managing symptoms and improving their quality of life, it is crucial to implement supportive and preventive strategies. These strategies not only help those with ADHD improve their focus and time management skills, but also create a supportive environment from family and the community. Additionally, raising awareness and educating the public about ADHD will help reduce stigma and create opportunities for individuals with ADHD to integrate and thrive. Methods to improve focus and time management play a critical role in helping individuals with ADHD work more effectively. Techniques such as breaking tasks into smaller steps, establishing clear work routines, and using tools like schedules and reminders can improve organization and task management. Additionally, creating a quiet, distraction-free workspace and taking regular breaks can help individuals with ADHD maintain focus for longer periods. These strategies can assist in managing time more effectively and reducing stress in work and study environments. The role of family and the community in supporting individuals with ADHD is extremely important. Families, especially parents, can create a stable and supportive environment that helps individuals with ADHD develop essential skills and improve behavior. Parents can help establish routines, provide rewards, encourage positive behaviors, and create a non-judgmental atmosphere. Communities can also provide support through educational programs, opportunities for social interaction, and by reducing stigma against individuals with ADHD, allowing them to feel accepted and more confident in daily activities. Raising awareness and educating the community about ADHD is a crucial strategy to reduce misunderstandings and stigma surrounding the disorder. When the community has a better understanding of ADHD, they can develop empathy and help individuals with ADHD integrate more effectively. Educational programs in schools, workplaces, and community organizations can help people recognize the early symptoms of ADHD, which facilitates early intervention and minimizes the challenges that individuals with ADHD may face. A clear understanding of attention deficit/hyperactivity disorder, ADHD, and the importance of timely support not only helps individuals with ADHD overcome life's challenges, but also promotes their overall development. While ADHD can impact many areas of life, with the right interventions and a supportive environment, individuals with ADHD can become strong and successful individuals. It is crucial for the community to continue raising awareness and to assist those with ADHD in finding suitable learning and working methods that enable them to fully unlock their potential. Taking these steps is not only the responsibility of the healthcare industry, but also of society as a whole, ensuring that everyone has the opportunity to live a happy and successful life. If you found this video helpful and want to learn more useful information, don't forget to like, share, and subscribe to the channel so you won't miss the next videos.